Welcome back to part 2 of our episode of Medoscopy. Our conversation continues now with Dr. Javaneh Jabbari. Did I get that right?
Yes.
Okay. And she is, like Dr. Noori in our first part, a vascular surgeon at the Vascular Center at Mercy. Thanks for joining us.
Thank you for having me.
So a little bit of background. Where are you from originally?
So I was actually born in Iran, but I grew up in Baltimore since I was 10 years old. So I lived in Towson and Catonsville. I mean, I say Baltimore, but not truly Baltimore City, but the suburbs of Baltimore.
Do you get back to the homeland every so often, or?
I have been. The last time I was back was 10 years ago, so it's been quite a while. But when I was growing up, we did try to visit family and so forth. But again, it's been a while since I haven't been back.
So I always like to ask, why medicine? Was this something you were always interested in, or it's like, you were going to be an artist, you were going to be something else? We had one doctor who got into finance and banking before she left that and got into medicine, or was, it was always something you wanted to do. How did it wind up?
Well, I can't say it was something I wanted to do when I was 5. I wasn't born to be a surgeon. But once I actually started my academic career seriously in college, I knew that I wanted to do something that was biology related. I always loved biology. That was something that I really loved in high school. It was what I majored in college. Initially, I thought I wanted to be a researcher and get a PhD, and kind of went through that route for a short period and got a master's degree and did quite a bit of basic science research. And then I realized that I like talking to people, and the lab is very lonely, and you just hang out with mice and stuff for a long time. And I was like, I think I missed the human aspect of this. And I did a lot of shadowing, and I kind of got different exposure to medicine. And that's when I decided that that was a better way of, practicing something biology related.
So you got into biology. Did you have to do the frog dissection like I had to do when I was in high school, or do all that sort of thing?
Yeah, and actually, I did do frog dissection in high school, but for a lot of my research, I did a lot of mice dissection under the microscope. But again, I rather work with humans.
Nothing the matter with that. Did you have a second choice? If this medicine thing doesn't work out, I'm going to do blank, or you just were sure you were going to make it?
I think once I committed to it, I was going to make it work. There was no, if this doesn't work, that was not an option. Before that, I did toy with the idea of becoming a lawyer, but that was back in high school. I was very interested in politics. I was part of the debate team in high school and really enjoyed that. I think I was kind of naive to what politics are back then. And as I grew up a little bit more, I realized that it's probably not the best place to help people.
But you ultimately got into vascular medicine and vascular surgery. Was there any other disciplines that you thought you might pursue?
So I'm a general surgeon by training. So I went through general surgery and became a vascular surgeon after that. So I did fellowship. So when I started general surgery, vascular surgery wasn't even on my radar. I thought I was going to be either a trauma surgeon or surgical oncologist. And that's what I pursued for a long time in residency. It wasn't really up until, further into my residency where I started to fall in love with vascular surgery. So no, vascular wasn't something that I wanted to do always, but I fell in love with it. And looking back, I don't think I could have done anything else other than vascular.
What made you fall in love with vascular surgery?
So the beauty of vascular surgery is that it's everything that's good about medicine and surgery. Vascular surgery is one of the most innovative fields in surgery. Everything changes year to year. There are procedures that come up every month, so you have to be very up to date on what's going on. Every patient gets their own customized treatment based on their anatomy, based on their functional status, based on a number of other things. A lot of the other disciplines in surgery are very protocol-based at this point. So, if X happens and you get Y, if Y is going on, then there's another, tree and there's some arrows, and you just kind of pull up an app to figure out how to treat the patients. Vascular is not like that at all. So if if somebody comes to me with a problem and goes to Dr. Noori, one of my partners, with a problem, we may come up with different plans for that patient, and they're both right. And that's the beauty of it, and that's the challenge of it. But also, we follow our patients sometimes lifelong. So it's not a quick fix and goodbye. So that's why I love vascular. Plus, we operate on pretty much every part of the body except for the brain and the heart.
Yeah, Dr. Noori mentioned that, and we also talked a little bit about the fact that sometimes there's some confusion, maybe among patients, between vascular and cardiovascular. We do run into that a lot with our media friends sometimes, and I'll say I have a vascular surgeon and said, oh yeah, it's heart month, and it's like, well, not exactly. So how do you clarify that for a patient who maybe is confused about that?
Yeah, so we have some of the same patients, but we don't do the same thing. So, in the most basic terms, I just tell patients, I don't operate on your heart or your heart blood vessels. So anything that's in the heart, I don't do. And I think, people understand that, but there's a lot of overlap. A lot of patients who have heart disease, especially coronary disease, not like heart failure necessarily, have vascular disease and vice versa. So we do end up treating a lot of the same patients. And cardiologists are some of the most knowledgeable folks when it comes to vascular disease. So there's definitely some overlap in some of the things we advocate for. We're all big advocates of taking statins. But I think a lot of patients understand the heart or no heart.
Now, I see you're a contributor and host on Audible Bleeding. It's a vascular surgery podcast for clinicians, trainees, and students. What made you decide to get involved with the podcast, and what have you learned? What's been your experience with listeners?
So I love teaching. That's one of the things that's I've always loved and enjoyed, and one of the reasons why I love working at Mercy, because we have fellows that train with us, and we'll have residents that are going to train with us next year. And Audible Bleeding was just another way of teaching and connecting with everybody else in the vascular field. And that's why I wanted to be involved in it. And it's also a great way where I could work with some of my colleagues from different hospitals, from different parts of the country, from even different parts of the world, and we can all learn from each other. The audience for vascular bleeding are a very specific subgroup. They're all either vascular surgeons training to be vascular surgeons or interested in vascular surgery. And it's been great to have them, support the program. I've only done a couple of episodes with them. It's a very popular podcast and a very successful one, and there's a number of people who are active with it, a lot more than I am. And if anybody's interested in vascular surgery, they should listen.
Well, we should have you on our Mercy Medcast podcast, which I'm sure all our viewers are going to be listening to on Spotify and Apple Podcasts, and also up on Mercy's YouTube channel. So that's fascinating. As frequent viewers know, a regular feature of our program is a kind of a show and tell. This is where the guests bring in an item. We're not sure what it may be. I mean, all sorts of different things, but it's important to you in some way. It says something about who you are and what you're about. So let's take a look at what you brought for us today.
So what I brought today is actually a painting that I did with my son, who's 3 years old. And it's important to me because my grandfather is a professional at drawing and painting. I mean, he's done some amazing work in his life. And so drawing and painting is really something that kind of connects us as a family. And it's something that I'm trying to pass on to my son, and he has a significant interest in it. Of course, the work that I like to do is very different than my grandfather's. I like Impressionism, and he did very traditional work, which also is, as you know, Impressionism was kind of like the new thing, that the idea of, seeing things in a different light, a modern way of doing art. And so I think that that's also a unique aspect of it. And it's just something that I really enjoyed doing with my son, and it's been kind of a bond that we have together. So this is a little work that we did together. I mean, as you can tell, if you look at it up close, it's a lot different than if you're going to be looking at it from far away. And it's fun to kind of see, you know, like what he sees in this and what I see in this when I take away from it and what he does. And I'm hoping to do a lot more of these as he grows up, and hopefully he'll be a better drawer and painter than I am. But I think it's a really nice family connection to always have with us and my grandfather.
It's a nice creative outlet. When I was in college, I tried my hand at oil painting. The very first thing I tried to paint, you know, it's like, oh, must be a still life, like a bowl of apples. No, I tried to paint my interpretation of pandemonium from Milton's Paradise Lost. That was the first thing I tried to paint. So, you know, if you're going to fail, fail spectacularly. So that's my mindset.
No,
that's wonderful.
That's a little bit of a hefty project for us. But
Well, speaking of hefty projects, obviously career medicine keeps you pretty busy. Do you find that you're able to manage a work and home life balance?
I think so. You know, there's really not a balance. Some days my work life is taking precedent over my home life, and some days the home life takes precedent over the work life. So it's not 50-50 ever. But I think with the right job and with the right partner, I have a very supportive spouse, and I have my family close by, so I have a lot of help. I think it's definitely possible.
I found over time that Mercy really has an international flavor. We've got doctors from Russia, Greece, Venezuela, India. You are fluent in Farsi, I understand. Well, what's it like working with colleagues from such diverse backgrounds? And do you think that's a strength for the hospital?
I think it's great. I think it's a big strength because it not only, you know, exposes you to different people of different background, different thought processes, but also I think it makes people more compassionate for the different patients that we see. Because I think people, when they are exposed to different nationalities, different thought process, diversity, they have this repertoire in their brain of all these differences and know that this exists. So when they see different people in their clinic, whether it's age group or sex or gender or whatever it is, it's not really new or challenging to deal with. It's just part of life. And I think that's a big factor. Plus I get to enjoy and be exposed to different cuisines and different holidays and so forth. So it's been great.
Well, Dr. Jabbari, I'd like to thank you for your time and your candor, and I'm hoping our viewers enjoy the opportunity, get to know you a little bit better. And thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. And until we gather again, may the road rise up to meet you. So you made it through the credits for Wait, Doctor, I Forgot to Ask. This is where we briefly ask our guest the question that they wish their patients would ask but don't. Or what's that most unusual hand on the doorknob question posed by a patient at the end of their visit? Dr. Jabbari, what do you got?
Okay, the question that I wish patients would ask, and I think this is kind of controversial, is what would you recommend if I was your family member? You know, a lot of times we're told, oh, you shouldn't really tell people that. You should just let them decide. But I think as a doctor, you have the responsibility to tell people what you truly think and why. And, you know, so that's definitely one that I welcome with open arms when people ask, especially in harder discussions. The second question, oh man, there's so many, but you know, I think some of my favorite ones are, I try to be thorough when I look at people's charts, but sometimes the systems that we have don't connect, and I love when before I'm leaving, patients are like, oh yeah, by the way, I was in the hospital last week with a heart attack and I got some heart stents. And so and that kind of changes everything we talked about during the visit. So I think that's always a funny one when people just bring up some complex thing that somehow we missed in the history and the chart.
Do you think sometimes it's just because people are embarrassed about certain things, or they're just not thinking it's that significant? I mean, I've always been amazed where doctors have told me, like, a patient will come in for a surgery and they'll ask the patient, like, what are you here for? And they don't know. And it's like, how can you be coming to the hospital for a procedure and you don't even know what it is? I mean, it's very strange to me. So what do you think is causing that?
I think sometimes, especially when you go to a specialist, you're there for a certain problem. So we can get very hyper-focused on that problem that, we miss what's going on with the rest of the patient. And again, I try to look at all these things in the chart, but sometimes people will go on vacation and be hospitalized. Like, I remember one of my patients went to California and got hospitalized for heart failure. And I can't see California's records. So that came up at the very end of our discussion. The question about patients showing up with and not really realizing what's going on, I think sometimes that's a failure of some of the doctors, because we can get really into the technicals and try to explain what actually is going to happen in the operating room and so forth, and really miss telling people what's going on in simple terms. But yeah, a lot of different things do happen. I mean, throughout my career, I've seen a lot of random things. But I will say, if it's something important that happened to you, in the last few weeks, just bring it up in the first part of the conversation.
Well, physicians can sometimes be in a bit of a bubble. That's one of the reasons we do this program, is to help pop that bubble, so that not just for the patients to kind of see who you are, but it's an opportunity also to kind of discuss issues like this, how physicians can connect better with their patients. So, because it's a two-way street. I mean, I think it probably works best when patient and doctor are working together as a team and they're both communicating with each other, wouldn't you say?
Yeah, I agree 100%. And I mean, you need to have a good relationship with your doctor. And the doctor needs to have a good relationship with the patient to, make them comfortable to be able to share things. Because if you're so stressed out about an appointment, then you may not think about all the other things that happened in your life last week, or are going on, or things that you wanted to say. And building that relationship where you're comfortable and trust the doctor is very important. I mean, I tell my patients this all the time, is I am a firm believer. I'm not very superstitious about a lot of things, but pretty much anything. But I'm a firm believer that if I'm going to operate on you, you trusting me is a huge part of the operation being a success. It doesn't matter how good I am, how many times I've done this operation, if I'm the best in the world at this. If you come into it and you don't believe that I'm gonna do a good job, or if you don't believe that we're doing this for the right reason, or if you have any negative thoughts, you may not get the best outcome that we can get. I really, really, really believe in that. And I think the first step to that is building a good relationship with the patient.
Excellent. Thank you, doctor.
Thank you.